Any discussion? All in favor, say aye. All opposed? Thank you. Next, we have the approval of the TAC meeting minutes from last month, April 24th, 2023. Make a motion that we approve the minutes from April 24th.
Second.
We have a motion and a second. Is there any discussion? All in favor, say aye. All right, thank you. Next, we have C, the director's report. Chad.
Mr. Chair, thank you so much. Good morning, members of Technical Advisory Committee. Just a quick report on a couple of items. One is electric vehicle plan update. Let's request Dora to give a brief update on.
Good morning, I'm Dora Gallo, Transportation Planner here at WAMPO. Just a little update of last EV plan steering committee meeting. So we discussed the purpose of the plan, current funding opportunities, committee roles, current EV charging stations in the region. And then we did two different activities. One, which was to brainstorm vision and goals for the plan, and then potential EV charging locations.
Thank you, Dora.
Thank you.
So much evolving on electric vehicles, and we are learning every day new things. Mainly utility companies, how to tap utility companies into our process is something we are exploring, and some other things. The next item here is, you all know carbon reduction program funding that we are considering. We got some applications. Thank you for those who sent the applications. At the moment, staff is working with project selection committee to find a schedule and a date to discuss the next steps on the applications and review the applications. So just want to keep you in the loop that there's a doodle poll sent by the staff and coordinating with project selection committee members to have a meeting soon. With that, I would like to return control back to our chair. Mr. Chair, thank you.
All right, thank you. All right, next we have public comments. Are there any public comments? Anybody online? All right, thank you. All right, next we'll move on to the action item. We do have one action item. It's the 2023 Unified Planning Work Program Amendment 2. Ashley, Chad.
You want me to go first?
Thank you, Ashley. Please go ahead. And this was there on the item last meeting, but there were some changes. We worked with our KDOT partners. So that's why this is, we did not have TPB approved on the item that we discussed in the previous meeting. So due to that, we went through the public participation process again and requesting you for seeking your approval. Let me request Ashley Bryce to discuss more. Thank you.
Thank you. So I am Ashley Bryers, Transportation Planning Manager here at WAMPO. And so the Unified Planning Work Program, or UPWP, is our budget. It sets what we're going to work on for the year. And we developed this way in advance to the actual year that it's for. And so this plan was developed last summer. It was approved in December. Then we needed to update it, and now we need to update it again through another amendment. And like Chad said, we already talked about this amendment last meeting, but then we realized we needed to add a few more things to it. And so we didn't complete the process. So these are the items that are included in the amendment. We're consolidating travel line items, adjusting staff line items to reflect actual hours, adjusting the budget and anticipated expenditures, adding the consulting services for accounting services, and adding the development of a bike-friendly map app. The two new items in this amendment is the adjusting all staff items to reflect actual hours and the adding of accounting services consultant. So the public comment period for this is May 17th through June 1st. We have not received any comments yet, but if we do, we will make sure we take them to the TPB when they look at this in June. Our budget is comprised of comprehensive planning grant funds, or CPG funds, which requires a 20% local match. And if this amendment is approved, the CBG expenditures and the FTA 5310, 5307 funding in this UPWP would equal about 2.5 million. So the action options are listed here, and they're to recommend that TBB approve it, not approve it, or approve it with specific changes. And we recommend approving it as presented. So I'm available for any questions.
All right, thank you. Are there any questions for Ashley? If not, I'll make a motion to approve the UPW Amendment 2 as presented. All right, thank you. All right, so a motion and a second to approve the Amendment 2 for the UPWP. So any discussion? All in favor, say aye.
Aye.
All opposed? All right, thank you.
Thank you.
All right, next we have discussion and updates. We have a KDOT Safe Systems Approach, post-crash care. Vanessa and Susan.
Thank you for having us today. Ashley, is WAMPO progressing the slides?
Yes, yeah.
Okay, all right. So my name is Vanessa Spartan. I'm the Chief of Transportation Safety at Kansas DOT. If you'll recall, about a year ago, WAMPO staff requested that KDOT occasionally come back and present on each of the elements of the new safe system approach as identified in the National Roadway Safety Strategy. Today, we're going to get into the element called post-crash care. So that is, when a crash does occur, what can we do to reduce injury severity, timely care, and then also to manage the crash scene so you don't get secondary crashes. So I'll get into a little bit later in the presentation what Kansas has done or is doing. But first and foremost, I think it's really important probably for Susan DeCourcy to go first to talk about the guidance that's coming from USDOT and NHTSA down. So I'm going to turn things over to Susan DeCourcy.
Thank you, Vanessa. Good morning, everyone. I'm going to talk a little bit about what NHTSA, the National Highway Traffic Safety Administration, is doing in the role of the post-crash care. So next slide. Let's see. Next one. Next one. All right, thank you. All right, so under the National Roadway Safety Strategy in 2022 looked at between the years 2011 and 2020, over 370 people died, 1,000 people died in transportation incidents, and more than 94% died on our road. So they knew that something needed to be done. Therefore, Safe System Approach was born, and there are 6 principles and there's 5 elements. The 6 principles is 1, death and serious injuries are unacceptable. 2, humans make mistakes. 3, humans are vulnerable. 4, responsibility is shared by everyone involved. 5, safety is proactive. And 6, redundancy is critical. And so those are the 6 principles. We have 5 elements, part of the Safe System Approach. 1 is the safer people. Other is safer roads. 3rd, safer vehicles. 4, safer speeds. And 5th, post-crash care, which is what we're going to talk about here today. There is a QR code provided for you should you want more additional information on SSA. And I will point out, it's not safe systems. It is just singular system because it's just one system approach with all of these principles and elements feeding into it. So next slide, please. This is just an illustration of the post-crash care for the US DOT, and we show that 42,915 lives, and that's an estimation. People died in traffic crashes in 2021, and it's definitely up from the previous year. And we look at the percentage of trauma deaths, which is 20% are preventable with optimal emergency and trauma care. So we can certainly save quite a few lives with good trauma care. And 2 out of 5 people were alive when responders first got there, but then later died. And then more than a third are seriously injured in crashes and are not taken to level 1 or 2 trauma centers. And then there's a 25% increase in the survival odds for people with severe injuries if they're able to get to these trauma centers. Next slide, please. So this is just an insert out of the National Roadway Safety Strategy, and that's basically saying USDOT is committed to the advances in survivability through the delivery of equitable and impartial post-crash care, which includes the EMS and 911 systems. Next slide. Key DOT post-crash care actions in the NRSS are 3 key pieces, and that is to improve the delivery of EMS throughout the nation, and also to improve the availability and quality of the EMS data, and then improve the EMS personnel on the scene safety through outreach and training. And we know that when we have timely arrival of emergency responders who are well trained, then that person is going to be able to assist in the crash scene and be able to get them to the trauma centers or where they need to go as soon as possible. Next slide, please. This is just a QR code, which does show the key DOT post-crash care actions in NRSS if you are interested in reading more about it. Next slide. So one of the offices in NHTSA is the Office of Emergency Medical Services. And some of the key things that we are working on in relation to post-crash care is to reduce the death and disability on our roadways and provide leadership and coordination to the EMS community and 911 communities, and then assess, plan, develop, and promote comprehensive evidence-based EMS and 911 systems. And so we bring together available data and industry experts to identify the most critical issues facing the profession of EMS. And then we tackle those issues through collaboration with our partners, through other federal agencies and national EMS organizations. And then, of course, providing awareness and education on the best practices and evidence-based guidelines is what we strive to get out to everyone. Next slide. This is just a repeat of the slide you saw, or a portion of the slide you saw before. But the important piece here is that approximately 40% of crash fatalities initially survive the impact, but then later die. And so, you know, that is just show how critical it is to the EMS system that the first responders get to the crash scene as soon as possible, to then be able to transport them to the facility in which they need, and, you know, getting the timeliness response, and then to have the first responders get to them as soon as possible allows the crash victims to have a better chance of survival. Next slide. So our message to highway safety community is appropriately resourced and well-designed EMS and 911 systems are essential to treating serious crash injuries and preventing them from becoming fatal, which is our ultimate goal. Next slide. And this is a post-crash care portion of the National Roadway Safety Strategy, and it is just bringing more attention to provide expedient access is the key there to the EMS, whether it be by air, by ambulance, by law enforcement, and even tow truck drivers. Next slide, please. This just walks through the transition of care that a patient would receive. And so when a crash occurs, the 911 is dispatched and providing response to that scene. And what's important on that second stage is that there's a timely on-scene arrival and care. And then the third part is the triage and transport to be able to get the person to that trauma facility. And then the last fourth one is to be able to provide care at that trauma center. And what's not listed here, but is still equally important to the process, is how all of this is recorded and the resulting data from the EMS activity and patient outcomes, because that goes to let us know if people are surviving or if they're not, and if not, why. And that's how we can try to improve situations. Next slide. So we have a National EMS Advisory Council, and they have provided a post-crash care letter, and these are excerpts of that. And it is basically saying that the experts say that they are encouraging the EMS and the EMDs, which is the dispatch adoption, so that all 911 calls receive evidence-based pre-arrival instructions, and then support the NMSIS adoption and linkage data, which is the National EMS Information Systems, and then encourage statewide adoption of National Trauma Field Triage Guidelines. And so these are the council is what they were, from the letter they sent, the pieces that they feel were the most critical for us to consider and for us as federal agencies to work on. Next slide. Anyone that wants additional information on that, there's a QR code to be able to see that letter of recommendations. Next slide. And then the bipartisan infrastructure law, also known as bill, did provide the U.S. Department of Transportation with additional funding and provided policies to bring strategies to life, and nearly 14 billion in new funding for roadway safety, including 6 billion authorized for new Safe Streets and Roads for All programs, which is going to help reduce crashes and fatalities. And then 4 billion added to the Highway Safety Improvement Plan, and then 4 billion improved for data collection, vehicle safety programs, and truck safety. So you can see there's a lot of money being poured into traffic safety with the ultimate goal to save lives. Next slide. So our portion of that, our being NHTSA, and specifically for today's presentation on EMS post-crash care, is that for the new grant program that we have, NHTSA supports the EMS community's efforts in the post-crash care into the state highway safety programs, where support by data and encouraging states to consider funding eligibility for EMS activities in their highway safety plans. And then also we strongly encourage all our stakeholders, including EMS communities, to work closely with the highway safety offices, which is in KDOT, and to offer ideas for potential activities that could potentially be an eligible grant funding program or project. And we are continuing to want to expand our partnerships, look into new ways of doing business. And so this is just another way to do that. And next and last slide for me. And this is just to show under bill, we have a 50% increase in funding, which, a portion of that is available for the highway safety offices to use for the safe system approach, which includes post-crash care. And both you and the EMS 911 community know how it best works in your community. And so we really want to hear from you and encourage you to reach out to the highway safety office to establish a relationship or a rapport or a discussion on post-crash care. So that is all I have, and I'll turn it to Vanessa, and thank you.
Thank you, Susan. So I wanted to give an overview of kind of the state of things in Kansas. If you go to the next slide, please. You may have heard me mention before, wait for the slide to advance maybe. There we go. So about a year and a half ago, we restructured an executive safety council that had been in existence for a while. And when I say restructure, what we did was we, go back one slide to where the logos were. There we go. We restructured the membership to have executives involved in it, and we changed the name from Executive Safety Council to the Drive to Zero Coalition to reinforce kind of the point of what we're trying to aim for, but also the whole overarching effort and campaign that we're working on. So the coalition has 22 members, and they are cabinet level representatives of state agencies. We have federal agencies represented. We have nonprofit and advocacy organizations represented. We have one private sector partner that deals with connected vehicle technologies. And then we have the transportation committee chairs from the House and Senate positions. So why do I bring this slide up? Well, when we did our last strategic highway safety plan, we were notably absent on emergency response in our strategies. And that's largely because the strategic highway safety plan that was drafted before was largely focused on what can the DOT do. And in Kansas, we have a Kansas Board of EMS, we have KDHE, we have these other partners that we didn't necessarily think about how their role is with emergency response. And so what I bring this up is that we will be updating the strategic highway safety plan beginning in 2024. So this membership structure really matters. And that's because we need to expand into the full safe system approach. So we need to be discussing post-crash care and understanding the role of these other state agencies in terms of helping to manage the safe system that Susan went over before. If you go to the next slide, please. So I wanted to give an overview of some other things that have happened in the past. So KDOT, using NHTSA as a consultant, did a study in 2007 that assessed the state of emergency medical services in Kansas. And then in 2017, KDHE did a ambulance service assessment as well. So there's some previous studies and some of them have recommendations in them in terms of what Kansas should be doing, that we aren't starting from scratch, if that makes sense. And then KDOT just decided to fund this last year, a study that we're calling Identifying the Golden Hour in Rural Kansas. So for those that don't know what the golden hour is, it's this idea of timely post-crash care. So when a crash does occur, can we get the emergency response, the first responders to the scene, and can we get the patient or the victim to the trauma center within that golden hour? And that's where we see the highest odds of survivability if we can get that expedient care within that time. So this study will more specifically look at where we have the golden hour in Kansas and where we don't. So we better understand our care facilities and how we transport back and forth. You go to the next slide. Okay, so what else does KDOT do? So we fund traffic incident management training across the state. So fire and EMS and police departments can all participate in those trainings for free. We are launching this summer a safety corridors pilot program. 4 corridors identified, one of which is I-135 between Park City and Newton. And in that, in the safety corridor process, we've been engaging with local stakeholders, including EMS and first responders in the corridor, to better understand issues with post-crash care. At the Transportation Safety Conference, which was just held in April in Wichita, we hosted a post-crash care session panel discussion where they talked about the needs to collaborate and coordinate across groups to be able to regularly have these discussions, understanding where there are constraints with concerns with post-crash care across the state. KDOT recently assigned a staff person internally within our State Highway Safety Office that will serve as an EMS liaison. The idea being that we start working on kind of building those connections and ties to this group that's so critical in survivability and crashes. As I mentioned, we'll be updating the Strategic Highway Safety Plan starting in calendar year 24, and we'll need to expand into that post-crash care discussion. So leading up to when we launch the update of the plan, the coalition will be having discussions about what does it mean to have post-crash care in Kansas? What does it mean to have a safe system in Kansas? Who needs to be at the table as part of these discussions? And then Susan mentioned earlier the Safe Streets and Roads for All discretionary grant program coming from USDOT. Kansas decided to support that program with a match structure, and more information can be found on our website. But basically, we saw it as a unique opportunity to allow local agencies to get into the data, to understand their issues and their opportunities and constraints in terms of their safety priorities. The Safe Streets and Roads for All plans are supposed to take a safe system approach, which means that these local and regional agencies would be talking about post-crash care as well as safer roads and safer people and all the elements that Susan went over before. If you go to the next slide, please. Okay, Kansas Board of EMS has a vendor. They're called Biospatial, but they manage an EMS database. And KDOT entered into an agreement with them to link the crash data to that EMS data, so it helps us to understand, how many of those emergency EMS calls were associated with crashes, and understanding some data that's in the EMS data that's not in the crash data. And then we've been having some discussions with KDHE involved in terms of if trauma data can be linked. I think KDHE has some, notable concerns related to how we would link the data in terms of patient records and concerns with HIPAA laws and things like that. So we don't yet know if that linkage will be able to occur in the data, but we are having the discussions. The second item there is that Kansas Board of EMS recently reported out at one of our traffic records meetings about they have a vendor that uses connected vehicle data in terms of crash notifications to give faster dispatch communications to the EMS dispatch groups. So that means that, rather than a phone call having to be placed, these connected vehicles that are part of it, a significant impact occurs. They can tell that in the vehicle telematics. They try to get a response from the person driving or in the vehicle. And if they don't get a response, then they send that dispatch out. So that's really interesting. I believe that they have one vehicle, I don't want to use the names, but one connected vehicle company on board, and then they're expanding into a second one. So that ends up getting, more of that data part of that system. They've also been talking about using the telematics data to better understand patient care reports in the future. So the way that I think about it is, the vehicle knows where the impact occurred and the physics of that impact. So they have some idea of, the vehicle's tolerance to that impact. Based upon that, they might have some understanding of what type of trauma might have occurred. So say, I think of, for example, a vehicle's, T-bones into a driver side. You might expect that there could be neck trauma, there could be hip trauma, and that could inform both first responders on the scene as well as communication to hospitals in the future. So next slide. I talked a little bit about our study of identifying the golden hour. So the goal is that we will try and wrap up by end of calendar year 24. We have researchers from Kansas State University conducting this research. The idea is that we will identify and map the golden era areas, especially in rural Kansas. And then we will develop travel time matrices and develop some preliminary recommendations for different agencies to consider. A future phase 2 of the study would actually be doing hazard-based duration models to predict the time to detect a crash and understanding how that's coming into play. So the maps on the right, while they're not labeled, I'll just step you through. The top map shows you all of the EMS service providers in the state. What it doesn't show you on this particular map is how many are volunteer versus how many are full-time. That affects travel time and response time. The middle map is the air ambulance facilities in terms of where you can operate an air ambulance out of. And then the bottom right map are the various levels of trauma centers in the state. As Susan mentioned earlier, really level 1 and level 2 trauma centers are what you want for the most serious crash levels. And we have 5 of those in the state. 2 are in the Wichita area. All the others are to the east. So as you might assume, our concern is really in rural Kansas and how you get expedient access to care when also, at the same time, healthcare facilities are consolidating and closing across the state. So this study will be really valuable for us to understand where we might have holes in the golden hour, and then future strategizing about what we do about those areas. If you go to the next slide. Okay, so that wraps up the overview of the post-crash care. I always like to put a little plug in. So as you know, the Drive to Zero mission, we have a larger coalition, but we also have emphasis area teams. So as I mentioned to everyone, we always are looking for fresh faces on the emphasis area teams. They're listed there. They range from risky driving behaviors to vulnerable road user types to different types of roadway features like intersection crashes. We also deal with a data support team that helps with analysis work. And then if you don't want to join a team, but you want to stay apprised of what the Drive to Zero Coalition has been working on, you can sign up to be what we call a friend of the coalition. And basically you get invited to participate in the meetings in a virtual setting. So you're in listen only mode, but you're able to kind of just hear what's being discussed. And if you're interested in either of those, you can contact me directly and we can get you signed up. And then I think the last slide, if you go to the next one, is just what I like to always say is, it is going to take everyone. That's the whole safe system approach. If we have humans making mistakes, then our roadways need to be forgiving. Travel speeds matter. Post-crash care matters. Everything matters in order to save those lives. So I think at this point, Susan and I can open it up for any comments or questions that the committee has.
Are there any questions?
Thank you, Mr. Chair, and thank you, Vanessa. I have a quick comment. This is Chad. Susan, thank you. That's a great presentation. WAMPO staff would like to continue explore how we can partner with your efforts. Kudos to you guys. Good efforts in, and then also Susan, you were mentioning of safe system, not the plural, also helps us. The safe system approach is something that WAMPO staff is working on a study, that comprehensive safety action plan. It's very timely that Susan and Vanessa are presenting today, because right after this presentation, we have Kendra Sheng, Erin, and Slade presenting the update of our WAMPO comprehensive safety action plan. Also, if Vanessa's and Susan's time is okay, to stay for some time to hear Kendra's presentation as well. We were exploring how cities and jurisdictions and state, we all come together for the grant application that is due in on July 10. So something we want to continue after this meeting to explore and coordinate how our efforts can channelize and also have a meaningful application towards the grant application that is due on July 10. So that's all the comment I have. Thanks again.
Just want to appreciate both of you for your presentations. I know traffic safety is definitely near to my heart. I know most of you probably don't know, but my daughter and son-in-law were killed in a car accident several years ago, and for inattentive driving on I-70, and their 9-month-old grandson survived. He was in a car seat. So I definitely appreciate car seats and the use of car seats. I see so many times kids not in car seats while they're going down the roads. And he just ended up with bruises, and he was 9 months old at the time, and we adopted him. He's like 15 now. So definitely appreciate everything that everybody's doing for safety and also post crash care. So thank you.
It looks like Justin
Chair?
has a question.
I do have a question for Vanessa or Susan if they have an opportunity to answer. This is Justin Short, Clearwater City Council. I was curious, in your studies and your research, do you by chance track first responder only facilities and not just ambulance based facilities?
That's a good question. We haven't really gotten into that. So we're just getting into this golden hour study. And then we are with the Board of EMS, we are looking at what they call their biospatial data. So I guess I'd have to see how they're breaking out the different responder facilities. Like if they're only tracking the EMS dispatch, that we may not be able to connect that dot quite yet.
Yeah, I would encourage looking into that one further. Even here in Sedgwick County, we have areas that don't have actual full-time ambulance services. We have a first responder pickup essentially with no transport, and that is EMS dispatched or 911 dispatched even here in Sedgwick County. So I'll look into that because I could plug in some of the gaps or give you an idea of maybe we don't have the golden hour over here, but we have a little bit of response time.
Right, right. That's a good comment. Thank you.
Are there any other further comments? Seeing none, thank you again. I appreciate everything.
Thank you.
Thank you.
All right, next we have a CSAP update, crash causes, next steps, and SS4A grant application. We have Kendra, Aaron, and Slade.
Right, I think I'm up first here. So I don't know if Ashley or one of the staff can pull up the couple of charts I'm going to talk about. And again, as they're doing that, just start with a little bit of background. I think I've presented a couple of times on some of the crash data and what that means for the region and kind of where this is kind of leading us as a group. And to kind of give you a recap, we did similar to some of the NHTSA data that they were presenting. We went back to a 10-year grouping of the data that gives us about 109,000 crashes. And from that allows us to draw a little bit more into the trends without having to worry too much about overrepresentation of the COVID years. So if you looked at just like a five-year, the last couple of years would kind of overrepresent 2 of those 5 years. So we chose to go a little bit farther back to kind of help offset some of that. Again, we're not ignoring those years, but there were some different driving behaviors that were prevalent during those times that may not be what we wanted to build the plan around. With that, at the last TSTA number 2, we kind of honed in on some emphasis areas within the region to look at, namely intersections, and then there were some overlaps with basically the speed and vulnerable road users within those intersection components. They all 3 really interrelated quite a bit. So the TSTA group actually chose to look at all 3 of those as emphasis areas to kind of further explore. And with that kind of another kind of question came up out of that meeting, and I think a few people have asked this, and it's what's causing the crashes that are happening as a whole. What's the main contributing circumstances that are going into these in the region? And from those crash data sets, we split that from intersection to non-intersection crashes to kind of look at those to see if there was a difference, because a lot of times you'll have both with, as Vanessa was even talking about, the speed differentials, things like that. We thought there may be a little bit of a difference. As it turns out, there really wasn't that much. The top 8 were the same between those 2, whether it was happening in intersections or outside of that. And when you start looking at those, the big takeaway, honestly, was that much to kind of what the chair said about inattention, about 30 to 33%, I think one was 32%, one was 33%. So right around 30% of all crashes in the region are some form of inattention. That was kind of the big conclusion that comes out of that. And so when you start looking at kind of these charts, this is kind of the listing of them. And you can have more than one contributing circumstance that causes a crash. So that's why you start looking at some of these and you get past the top 8, you start seeing a couple of those on the list. That's why you could even have multiple in one, a single person can still have multiple contributing circumstances that are assigned to them. So with that said, there was a pretty good, amount of crashes that did kind of coincide with both intersection and non-intersection crashes. And then again, looking at them as a total, inattention is the most prevalent form of those. Again, there's a number of others, following too closely, running red lights, things like that as well, that are in that top 8. But if you really want to focus in on on stopping things, that's probably the main area to kind of look at. So with that, I'll turn it over to Kendra. I think she's gonna keep going with some of the grant information.
Yeah, thanks, Slade. So I don't have an official presentation or anything to show at this point, but wanted to talk through our next steps for the CSAP plan, the Comprehensive Safety Action Plan. So we did have our third and final TSTA meeting last week. It was a great meeting, beautiful day. We actually took a field trip around the WAMPO offices there and saw a couple of intersections and talked through some of the issues that we were seeing there. And all of that's coming to help us inform the recommendations that will come out of this plan. So really kind of the next steps that our next thing that we're really focusing on is the Safe Streets and Roads for All grant. So they talked about that in the presentation before this one, but looking at how the WAMPO region could submit an application for that grant. So there's two types of applications. One is the planning and demonstration grant, and the other one is an implementation grant. To be eligible for the implementation grant, the Comprehensive Safety Action Plan would need to be completed. Right now, it's still in draft form. We're still putting it all together, so it's not been completed and approved, and likely won't be before the deadline of July the 10th. So what we're looking to do is apply for a planning and demonstration grant, which will set us up for an implementation grant in the coming years. So we're actually talking through some of that this week. Really what we're looking at doing is some additional grassroots community engagement, messaging around bicycle, pedestrian, and driver safety, looking at doing some demonstration in terms of temporary applications of countermeasures. So looking at if we did removing sweeping right turns, for example, we can put those in using flex posts. That can be a temporary solution as a demonstration. And we're looking at doing some before and after testing of different countermeasures that have already been implemented, looking all really to inform what we could apply for from an implementation grant standpoint. We want to really find several corridors, intersections that really need the most safety improvement, and then apply for an implementation grant for the region, not just for Wichita, not just for Sedgwick County, but for all of the jurisdictions in the area. So really kind of thinking through that, and that's our next steps moving forward with the CSAP itself. So with that, I will entertain any questions or comments.
Any questions or comments?
Thank you so much, Kendra and Slade. Yeah, I think the next meetings will coordinate with jurisdictions and KDOT staff as well. Is there a presentation by Erin about the next public meeting? If not, I will share with the audience today.
No, she was not able to make the call today. So if you have information, or I can, either way, I can share it as well.
Thank you, Kendra. I think, we have a Transportation Safety Committee workshop and open house, a public meeting at Bike Walk Wichita at 325 North St. Francis Avenue. That's on Thursday, June 8. That's between 4 p.m. to 6 p.m. It's mostly a come and go event, but so much to learn about what all WAMPO has accomplished so far, what are the next steps, and everything anyone wants to know, public or us or anyone. So that would be another opportunity for us. So June 8th, 4 to 6 p.m. Thanks again.
All right, thank you, Chad. And thank you for both for being on today. All right, next we'll move on to the MTP 2050 update, survey and milestones. Ashley.
Thank you. So the MTP is the Metropolitan Transportation Plan, and that is our long-range plan that sets a vision for transportation in our area. And we are starting this update process where we are looking out to the year 2050. And we're beginning to do a bunch of engagement activities. We've been to several events, well, two, I guess, the last 2 weekends. And we've been just talking to people as they walk by and asking them to take our survey. And actually, there's a little survey card at each of your seats. If you could take our survey for us, that would be wonderful. We are going places where people already are, rather than expecting people to come to us. And I think it's worked pretty good so far. I got sunburned, Marcella got sunburned, so we're learning to take some sunscreen. We will be having some stakeholder listening sessions in June. We'll be having 8 of them, a couple of them online and a couple of them in person. And then we'll continue through this process. The call for projects will be on September 5th, I believe, September 5th. But we'll have more information as it comes closer. Any other questions or anything about the MTP process?
Thank you, Ashley.
Yep.
All right, next we have committee and partnership updates.
The Active Transportation Committee, we have a next meeting on September 6th. Is Jack Brown or Alan Keeler online?
This is Jack, I'm here.
Thank you, Jack.
And you
Please
want
go
me to
ahead.
make-
Yeah, please go ahead and with the update on Active Transportation and Safety and Health Committee. Thank you.
Yeah, as far as Active Transportation Committee, we're waiting primarily for the completion of the Wichita's master bike plan to be integrated into ultimately regional pathways revision. And on the Safety and Health Committee, we have a meeting in August to get see hopefully a draft of what the consultant has in regard to the comprehensive safety action plan. Basically, that's it. We're relying heavily on the actions of the consultants, and from my perspective, they're doing a very good job. It's been an interesting process.
Thank you so much, Jack. And our Jack Brown had been safety committee lead for the past 2 years. Every quarter we used to meet, and then we all are excited about the plan and the study. It's all coming together with KDOT's efforts and our Wampo region efforts, and with the grant, and hope we all converge in towards implementation and some of the action plan and strategies towards this. The next item is executive committee, and that's scheduled Thursday, August 3rd at 11 a.m. It's open for all, although executive committee members are primarily discussing the items and run the meeting. They participate, but anyone is welcome to listen. And the next item is Economic Development and Transportation Committee. Anyone on that? If there's no one to update on that, I can provide an update on that. Thank you. We have a next meeting on June 12th at 10 a.m. Monday. Good work had been taking place by CDBR, Center for Economic Development and Business Research, that Wichita State University and their staff is conducting to develop regional measures such as affordability of housing, demographics, variety of economic and demographic indices for the region are being developed. It's very difficult to quantify economic development of region, but still we were very pleased to see how the economic impacts on transportation system and then, transportation impacts on economic growth had been studied through this process. I think the next step on this study is developing demographic and socioeconomic data forecasts. And we would keep this body and this Transportation Technical Advisory Committee members will make a presentation in the future once they are developed. With that, there is next item, United Community Transit Coalition. Let me request Ashley Briers, our Transportation Planning Manager, to update on.
Thank you. We held our second ever United Community Transit Coalition meeting last week and had some good discussion, and we're going to keep moving forward, trying to see how we can coordinate transit. Our next meeting is on August 17th.
Thank you, Ashley. And Wichita Transit, any update on data ridership or any updates? Okay. Okay. Okay, thank you. With that, Mr. Chair, thank you.
All right, thank you. Next, we have other business. Is there any other business?
I do have one thing. I misspoke. The golf projects will open on September 15th, 2023.
Golf projects will open on September 15th.
15th, yeah.
Okay. All right, any other business? All right, next on our agenda is adjournment. Make a motion, we adjourn today's meeting.